Starting off with a half effleurage from the chin up to the temples. I like to do this 3 times before then adding in some circular motions to help break up any makeup or oil that's sitting on the skin. Before doing a full effleurage, we're just taking the product up, over the nose and to the forehead. We like to do this twice. First is a superficial, second is a deep cleanse. And I like to call this the prayer motion, because the hands together to start, up the face, to then finish over the forehead and to the temples. I then like to do this 3 to 5 times before moving on to the next step and adding in some circular motions again to the chin and jawline. This client is coming with no makeup at all, so I've done the superficial and the deep cleanse in one, but you can wipe off the product and then do the deep cleanse again now. So now I'm using our bamboo pads and just some plain warm water to remove the product from the skin. Making sure to remove the product from their neck as well. Now going in with the vitamin C scrub, starting again on the chin and doing the prayers up towards the temples before moving up towards the forehead to move the product around. Then I really like to go in with some nice circular motions to really exfoliate the skin. I like to be quite vigorous just so the client feels like we are really trying to exfoliate the top layer of dead skin, and they will feel the little bead grit against the skin. It just feels like having a nice deep cleanse. So don't be afraid to be a little bit firm during this part of the treatment. Making sure to include the nose. So sometimes I like to support one side of the nose with the other finger whilst I work one side of the nose, and then doing nice circular motions up on the forehead and around the temples. You can do this one side at a time or together like I am now. And then going down to work the lower part of the face, including the neck, jaw and cheek area and around the mouth. Nice circular motions. And then we're just going to use the bamboo pads and some warm water to remove the scrub. Working from the neck up the face. Making sure to get rid of all the grit from the skin, as this can be a little bit irritating during the radio frequency part. Now we're going to start applying the conductive gel to the skin. You can do this with your hands or using a spatula, I'll show you both. But for now I'm just going to be using my hands just to rub the gel around the face. I like using my hands so I know just how much has gone onto the skin. But with the conducting gel we will be stopping and applying more throughout the treatment, because the skin just loves to drink it up. Making sure to go all the way down the neck, because this is going to be our starting point. And you can take it further down the neck than I am, you can take it right down to the chest. My client wants me to focus on the jowl area. I'm turning the Pro machine on, and I'm turning radio frequency face on, and I'm going to start around 25%. I'm going to give it a few moments just to warm up before then applying it to the client's neck. We're going to be starting just over the windpipe and slow circles towards the outer side of the neck. And remember, we're going to be spending 2 to 3 minutes per area. So we're just really allowing this tissue to warm up, and it's that warmth that's triggering the body's wound response, repair mode, and that's going to be leaving the skin with nice collagen and elastin fibers. The area I'm doing now is the client's concern. This is the jowl area. So I'm really going to take my time on this area, and I will finish on this area as well, just so the client really feels like I've targeted this area. Her skin is definitely very dehydrated. She's just got back from a holiday, so I'm going to have to apply some more conducting gel because I can already feel the device dragging on the skin, and we don't want that. We want a nice smooth glide. And I've now increased the machine to 30 to 35%. Now I'm just going to do a close-up of the motion that I'm doing with the device. So just nice slow circles around the treatment area, and we just want to allow this tissue to warm up to stimulate the collagen and elastin fibers. Making sure to go underneath the jawline, because this is a concern for quite a lot of women that will be coming for this treatment, and it's just going to really tighten and sculpt that jawline for them. As we age, we do lose our fat pad, so that is what is causing the drooping of the skin, and we're just tightening up this area again. This is why we recommend a course of treatments, because with each treatment we're creating a new layer of collagen and elastin, and we just want to build these layers up. So now we're just going to work our way around the face. You can use the map that's in the manual, but essentially we're doing exactly the same motion, but just working our way up the face, working with the lymphatic system towards the temples, towards the ear. Now I'm going to apply some more conductive gel using a spatula. Spatula is nice because it does put a thicker coat on the skin, but as you can see, it kind of goes in areas instead of being massaged around the face. So now I'm just going to continue with following the guide around the face, and then I'll repeat on the other side. When doing the other side of the face, we just want to make sure we're not trailing that wire over the client. So I hold with one hand the hand device, and the other hand I'm holding the wire. You'll notice how your client starts to get more relaxed throughout the treatment. So at first I'm normally a little bit chit-chatty with them, but as the facial progresses, I normally stop talking and just allow them to enter relaxation. I like to make sure I've got nice relaxing music, normally acoustic music going on in the background. I'm going to apply a nice thin coat of conducting gel on the skull again, ready to enter the EMS part of the facial. So with EMS, I like to start on about 5 to 10% with the client to start with, because everyone's muscle groups are different. You can always increase as you go. So we're starting with the corrugator. So this is the muscle between the eyebrows, and this is the muscle that allows you to frown. So by stimulating this muscle, the motor point, we're going to be conducting the muscle, which is just basically giving a workout for the muscles, giving a nice lift. We're just gliding back and forth, making our way over to the frontalis. So the frontalis is what causes our eyebrows to raise and give us that surprised face. If a client has Botox, I would avoid doing the forehead just because it will break down their Botox faster. So it's great if someone's wanting to break down their Botox, they can come for this treatment and it will help break it down. And now we're around the eye, so the orbicularis oculi, going back and forth. Once you see that visual contraction, just hold it for a few seconds, and this is just really working out that facial muscle. Before we then move around the side of the nose to work the nasalis and the alleviator of the top lip. By going back out, gliding back out to the temple and back, we're going to be working the buccinator and the zygomaticus. As we work round towards the mouth, we're then going to get the orbicularis oris, and then working our way round the masseter to the mentalis on the chin. Very Similar protocol to when you do microcurrent. And then we're just going to glide our way back up the face. So normally each side takes about 2 to 3 minutes. So then, like I said, moving our way back up towards the forehead to finish on the corrugator before then doing the opposite side of the face. Going in with some warm water and the bamboo pads to remove the conductive gel. So I like to then apply the face mask next, because I like to leave the client feeling totally relaxed after having the next holistic part of the facial. But you can do the mask after doing the facial cupping and guasha if you prefer. I just like to use a wooden spatula to apply the chosen mask. For this client, I have chosen the enzyme peel just because she's just come back from holiday, so she's got quite a lot of pores that are blocked. So the enzymes are just going to go in and help break down the dead skin and the blackheads. Apply this all over the skin in a nice layer, and then I leave for 5 to 10 minutes before removing with the bamboo pads, ready for the next part of the facial. The next part is more of the relaxing aspect. So for the next part, I like to undo the headband just so I have access to the client's scalp. Quite nice, the client feels like it's the end of their treatment, but actually we're only halfway. We're then going to remove the mask, but using warm water and the bamboo pads. So now I'm going to do a mini face, neck and shoulder massage. So I'm applying the Daily Oil Glow, starting with the half prayer towards the temples. We're going to do this around 3 to 4 times. Before we then do the full prayer, which is taking it up around the nose towards the forehead, to really just move this product around to make sure we've got an even amount of product, because this is going to help with the glide of the next part of the facial. And then we're just going to move on to some circular motion. So this is like a cool down for the muscles that we just worked with the EMS. Circular motions around the side of the head, the temples, then working the corrugator, the frontalis, and then back around the side of the temples. And then we're going to do circular motions under the eyes. We're just going to start stimulating that lymphatic drainage on the face. Next, we're going to go and start doing some knuckling down the bottom of the face. This is helping to sculpt the jawline. And then I like to take the knuckling to the shoulders and the back of the neck. Normally ask if the pressure's okay at this point. And don't be afraid to stop and get some more oil. It makes the experience so much nicer for the client. You can just take your thumbs and do circular motions if you feel like there are some knots. If you've already learnt massage, you can just use the massage you have already learnt. This is just some basics to help get you started. To then knuckle back up the neck and shoulders. And then finishing with some prayers up the top of the face. And then grab your clean guasha. And we're just going to start in the middle of the forehead on the corrugator muscle. And we're just doing nice circular motions up into the hairline. This is the best part. Again, we're just going to follow the face around, doing nice circular motions. This is great for any clients that get a lot of tension in their scalp or suffer with migraines, hay fever. It's just really good for depuffing the face, getting rid of toxins from under the skin. My client was frowning. She wasn't aware that she was frowning, so I just took the Guasha tool and did a little bit of this scraping on the skin just to relax that muscle. We want the face to be completely relaxed during this treatment. To start with, you can print out some of our manuals, which has the protocols of the drawings, the diagrams, and have this next to your bed. This is what I did when I first started. This is a mini version of the Guasha massage that you will have learned in the main course. So now we're just going under the eye, again doing nice circular motions, and I'm just using my other hand just to support the skin and pull it tight. Go down and start sculpting the jawline. Without realising, you can hold quite a lot of water retention under your chin. Next, we're going to stimulate the lymphatic system. Just going to glide straight down the neck towards the chest. Do this 3 times before then drawing up and then sculpt around the jaw towards the temples. And we'll do that 3 times as well, before then doing some scraping under the jaw towards the jawline, and then we're going to start scraping up the face. Before taking it back up to the forehead to do some scraping, and then we're going to start on the other side of the face and repeat what we have just done. moving on to the cupping section. So by pinching the cup, it's going to suction up some of the skin so we can do a nice lymphatic drainage, and it's also helping to prevent deep wrinkles and fine lines. So starting with the forehead, working out towards the temples, and then we're going to go under the eyes, and then we're going to do some suction and release. So this is just going to help get rid of any dark eye bags, any puffiness around the eyes, especially if you struggle with like hay fever, you get swollen eyes. This is just going to help remove all the swelling. Always working towards the lymph nodes. And now we're working the nasofolds. We're working down that line and basically creating a V, because we're dragging it back up towards the lymphatic system to get rid of the toxins. And now we're doing some suction and releases. before, removing that to the lymphatic system. Now doing some nice jaw sculpting, so always pulling up towards the lymph node and then working down the neck. So if you think of your skin like paper, the more you use your facial muscles, the more you are basically creating a fold in the paper. But by doing treatments like this, we're helping to prevent those folds from getting too deep, and we're also reducing the depth of the folds. The folds are wrinkles. So these treatments are great as a preventative as well. And then I like to just go in with some prayers to finish, because we've still got the oil on the skin. We're going to take this all the way up the face, so a full prayer. And I just like to do some circles around the temples. And then we're going to apply our serum, again using prayers to move the product around the skin. And then we're going to repeat the same with our moisturiser to finish. And then I like to offer the client a drink. I'll remove myself from the room so they can get dressed. And then I'll ask them if I can take an after photo, how they found the treatment, and if they'd like to rebook. As well as going over the aftercare, of course.